Needles versus cannula for filler. Needles versus cannula, what are the differences when injecting dermal filler? This is a common question. Facial fillers have typically been injected using needles. Most fillers come packaged with 2 half-inch needles as the recommended means of injecting the product. An alternative is using a blunt-tipped cannula. A cannula is a longer, rounded, tipped, or blunt-tipped, needle-like tube used to place filler. Because it's so thin, it may be called a microcannula. A significant advantage of using cannulas is the reduced likelihood of penetrating blood vessels, especially arteries. While this is a rare complication, injection of filler into arteries can lead to serious complications, including blindness, stroke, and death. And so the majority of practitioners still use needles to inject fillers, although cannula use is increasing. Technically, it's more difficult to use a cannula. The learning curve associated with using one is combined with the additional cost of purchase, and that may account for the lack of usage among injectors, despite their advantages. When using a needle, the sharp tip of the needle penetrates through the skin and down to the depth where the filler is injected. Because a cannula has a blunt tip and cannot pierce the skin, a needle is required to make an entry point for the cannula. The blunt-tipped cannula can re-enter the same access point without having to hurt the patient with another needle puncture, and can reach farther from the entry point to place the filler. Because needles can easily pass into or through a vein or artery, there is more chance of bruising or swelling. Cannulas offer advantages for the patient and the practitioner. Less needle sticks are more comfortable. The rounded or blunt tip minimizes bruising and swelling and is safer. They can be used in most of the areas filler is used. As you research for an experienced injector, regular use of a cannula is a helpful criteria, in addition to training and years of experience. For more related advanced answers, select one of these videos. And please, don't forget to give us a thumbs up and subscribe to our channel for more videos, live surgery footage, real patient experiences, demonstrations, and so much more. And if you have questions, feel free to send me an email. I'd love to hear from you. See you in the next video.